Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, today we can see questions from fundamentals of nursing as we already completed pediatric nursing and OBG one set of questions. Today subject wise discussion, fundamentals of nursing questions. First question, which among the following is used for irrigation of bladder and for cyst bath? Options, option A, Acriflavine, option B, mercurochrome, option C, potassium permanganate, option D, lysol. Here, question is, which solution is used for irrigation of bladder and for cyst bath? Correct answer is option C, potassium permanganate. Okay, so concentration of 1:5,000 to 1:10,000 solution, which is used for mouthwash, irrigation of bladder and for cyst bath. Okay, potassium permanganate and the concentration is 1:5,000 to 1:10,000, which is used for mouthwash, irrigation of bladder and for cyst bath. The next question, which among the following is used to reduce edema? Options, option A, Sidex, option B, glycerin Maxell solution, option C, potassium permanganate solution, option D, lysol. And the correct answer is option B, a glycerin Maxell solution. This is concentrated solution of glycerin Maxell is used as a hygroscopic solution to reduce edema. And also this is used in dressing of wounds in case of cellulitis. Okay, glycerin Maxell solution. The next question, the term which describes no harm to patients is known as. Options, option A, veracity, option B, non-maleficence, option C, fidelity, option D, none of this. Correct answer is option B, non-maleficence is the term which describes no harm to the patient. Okay, option B is the correct answer. First option, whereas it is there, that is known as telling truth, and fidelity means keep promising. Okay, here our question answer is option B, non-maleficence. The next question, sudden return to normal temperature from very high temperature within a few hours or days is known as. Options, option A, decline, option B, crisis, option C, lysis, option D, a relapsing fever. So this temperature is returned to normal by suddenly. Okay, sudden return of normal temperature from a very high temperature is known as crisis. Option B is the correct answer. Crisis means is a sudden return to normal temperature from very high temperature within few hours. Within few hours or within few days it will become normal. Very high temperature means like hyperexia or hyperpyrexia. Like hyperexia means 103 to 105 degree Fahrenheit, or hyperpyrexia means above 105 degree Fahrenheit, that from high temperature to low temperature. That is known as crisis. Crisis include true crisis and false crisis. True crisis means temperature falls suddenly within few hours and reaches normal. That is known as true crisis. False crisis means a sudden fall in temperature but not accompanied by improvement. Okay. That is known as false crisis. Crisis, true crisis, false crisis. The next question, preservatives used for collecting 24 hours urine specimen is. Options, option A, hydrochloric acid, option B, formalin, option C, chloroform, option D, all of this. Preservatives used for 24 hours urine specimen collection. Correct answer is option D, all of this. Hydrochloric acid, formalin, chloroform, all we can use for preserving urine for 24 hours. The next question, elevated specific gravity of urine is seen in. Option A, diabetes mellitus, option B, diabetes insipidus, option C, hypercalcemia, option D, renal failure. Correct answer will come option A, diabetes mellitus. Okay, Elevated or specific gravity is high in case of diabetes mellitus due to the presence of sugar. Okay, in diabetes insipidus, the specific gravity is decreased, or low specific gravity we can see in diabetes mellitus, and high specific gravity we can see in diabetes mellitus. So in case of renal disease also, the specific gravity will be low. The next question, failure of the kidney to secrete urine is known as. Options: option A anuria, option B oliguria, option C suppression, option D in none of this. Correct answer is option C suppression. First option anuria. Anuria means total absence or marked decrease of urine is known as anuria. And oliguria, option B, decreased quantity of urine, that is urine less than 400 ml per day is known as oliguria. And failure of the kidney to secrete urine is known as suppression. Anuria, oliguria and suppression. Move on to next question. In hypokalemia, the specific gravity of urine is option A low, option B high, option C normal, option D low and high. In hypokalemia, the specific gravity of urine is low. Option A is the correct answer. And to next question, cloudy appearance of urine is due to the presence of option A sugar, option B phosphate, option C uric acid and option D stones. Correct answer is option A phosphate. Cloudy appearance of urine is due to the presence of amorphous phosphate. If the option amorphous phosphate is there, means that is the correct answer. So cloudy appearance of urine is due to the presence of amorphous phosphate, and this amorphous phosphate will disappears with the dilution of acetic acid. That is also important point. Okay, this will disappears with the dilution of acetic acid. The next question, grains of pepper appearance in urine is due to the presence of option A stones, option B mucus, option C pus, option D uric acid. Grains of pepper appearance. Correct answer is option D uric acid. And first option stone. If fine sand is present in the urine, means that indicates stone. Okay, and the urine appears as a flocculent cloud, cloudy nature, that means it is mucus in the urine. Okay, and if we are taking urine in a test tube, and the test tube, the urine is settled as a heavy cloud at the bottom, that indicate pus in the urine. Here our question, grains of pepper appearance, that indicate uric acid. Option D is the correct answer. And the next question, lymphatic fluid is aspirated from the pleural space is known as option A pneumothorax, option B hemothorax, option C pleuritis, option D chylothorax. Question, lymphatic fluid is aspirated from the pleural space is known as chylothorax. Option D is the correct answer. Next question, intraosseous injection is given in option A vein, option B bone marrow, option C spinal cavity, option D muscles. Intraosseous injection means injection which is given into the bone marrow is known as intraosseous injection. Into the vein means intravenous injection. Intraspinal or intrathecal is known as into the spinal cavity. Okay, intraspinal or intrathecal is into the spinal cavity. Into the muscle means intramuscular. Next question, urinometer is used to detect option A sugar in urine, option B specific gravity of urine, option C bile in urine, option D acetone in urine. Correct answer is option B. Urinometer is used to detect the specific gravity of urine. And the normal specific gravity of urine is 1.016 to 1.025. The next question, a reagent used to test bile pigment is option A sulfur powder, option B iodine drops, option C Benedict solution, option D ammonium sulfate. A reagent used to test bile pigment. Correct answer is option B iodine drops. And the test for this bile pigment is known as Smith test. Here we are using reagent iodine drops. The next question, which of the following agent is used for disinfection of surgical instrument against HIV? Option A hydrogen peroxide, option B 2% glutaraldehyde, option C Savlon, option D Dettol. Correct answer is option B 2% glutaraldehyde. The agent which is used for the disinfection of surgical instruments, which is used for HIV patient. Okay, 2% glutaraldehyde is the correct answer. The next question, flow of oxygen in yellow color Venturi mask is options. Option A 6 liter per minute, option B 8 liter per minute, option C 10 liter per minute, and option D 14 liter per minute. Correct answer for this question is 8 liter per minute. Okay, in yellow color the flow of oxygen in yellow color Venturi mask is 8 liter per minute. First option 6 liter per minute, that is for orange color Venturi mask, and 10 liter per minute by a red color Venturi mask. Here our question is yellow color Venturi mask which delivers 10 liter per minute oxygen flow. The next question, what do you mean by passive exercise? Option A physical activity performed by the patient without assistance. Option B the activity performed by another person and the patient makes no voluntary effort. Option C the physical activity carried out on the floor. Option D none of this. Correct answer is option B the activity performed by another person and the patient makes no voluntary effort. Here question is passive exercise means what? Okay, there are active exercise and passive exercise is there. Active exercise means the activity or the exercise that the patient is doing without assistance, that is active exercise. And the passive exercise means with assistance or with help the patient is doing the activity. Okay, that is known as passive exercise. Here our question is what is passive exercise? Option B is the correct answer. And the next question, application of drug into the skin is known as options. Option A inhalation, option B insertion, option C instillation, option D injection. Here correct answer is option D injection. Injection is a topical application, that is the application of drug to the skin by friction. For example, ointment we are applying on the skin, that is known as injection. Okay. Inhalation means here the patient inhale the medicine into the lungs, that is like fumes the patient is inhale the medicine. Insertion means like introduction of medicine solid forms into the body. For example, suppositories, we are keeping suppositories for temperature, antipyretic suppository, analgesic suppositories there, that is insertion. And next is instillation, that is putting a drug in liquid form into the body cavity is known as instillation. For example, ear drops, eye drops and all giving like instillation. Move on to the next question. Which type of respiratory pattern indicate increasing intracranial pressure in the brainstem? Option A slow irregular respiration, option B rapid shallow respiration, option D slow following rapid respiration, option D none of this. Correct answer is option A slow irregular respiration. In case of increased intracranial pressure, we can see Kind stroke respiration, that is respiration followed by apnea. Apnea means absence of breath. Okay, and then a respiration, then short apnea, then again respiration, that we can follow in a patient with increased intracranial pressure in the brainstem. So option A is the correct answer. Next question, which among the following is not a local manifestation of inflammation? Options are option A redness, option B warmth, option C increased WBC count, option D pain. So question, which is not a local manifestation of inflammation? Correct answer is option C, increased WBC count. The main immediate local manifestations include redness, warmth, pain, swelling or the local manifestations of inflammation. But this increased WBC count, all are the blood related, okay, systemic manifestation. And the next question, red patches on the soft tissue is known as option A leukoplakia, option B erythroplakia, option C leukocytosis, option D erythrocytosis. Red patches on the soft tissue is known as erythroplakia. Option B is the correct answer. Leukoplakia means it's a white patches, that is leukoplakia. Erythroplakia means red patches mainly formed in the mouth and other mucous membrane, that is known as erythroplakia. Leukoplakia is white patches, erythroplakia is red patches. Okay. The next question, which is the suitable position for a patient just received from OT after nephrectomy? Options, option A follows position, option B semi follows position, option C supine with head turned to one side, option D side lying position. Correct answer is option C, supine with head turned to one side. Nephrectomy means it's a removal of kidney. Okay, fully or partially removal of kidney is known as nephrectomy. It's one of the major surgery. So in this case, we are not giving Fowler's or semi-Fowler's position to the patient because after anesthesia, there is a chance of hypotension. Okay, or the ICP, intracranial pressure, will decrease, which may leads to headache to the patient. Okay, so we are not advising Fowler's or semi-Fowler's position. We are giving supine position with her turned to one side. If we are turning to one side means secretions are coming, that will come out. So we are giving supine and her turned to one side. Option C will come correct over here. The next question, which childhood malignancy present with a raccoon eyes? Option A retinoblastoma, option B neuroblastoma, option C Kaposi sarcoma, option D Ewing sarcoma. Correct answer is option B neuroblastoma. Childhood malignancy with raccoon eyes is represent neuroblastoma. The next question, brown crust which are formed on the teeth and lips are known as option A dental plaque, option B sores, option C calculus, option D all of this. Brown crust which is formed in the teeth and lips are known as sores. Option B is the correct answer. The next question and the last question in the series, riboflavin deficiency result in options. Option A stomatitis, option B sores, option C calculus, option D chelosis. A riboflavin deficiency which result in option D chelosis. Vitamin B2 is known as riboflavin. The deficiency of vitamin B2 which result in glossitis. Glossitis means inflammation of the tongue. Also this riboflavin deficiency which cause chelosis. Okay, here chelosis is there, so that is the correct answer.